Hello and welcome. This conference is organised to support the work that we want to do with the people that we serve, with the communities that we serve, to create new sorts of services going forward. Services that will meet the needs of the whole person, physical and mental, because all of us have those needs.
Gloss Talks is a campaign with a very simple message. Every time you talk openly about mental health, you are fighting stigma. We want this message to go to every single part of Gloucestershire, and especially to communities who are most at risk of suicide.
Mindsong is a charity that works in Gloucestershire, and we provide music therapy services for people in their own homes, for care homes, for people that need to come out and sing with other people and their carers in day centres.
We have got £2.3 billion to invest in mental health over the next 5 years. That's a real £2.5 billion. My team at NHS England can STP by STP and place by place tell you how that money flows, what for, when it's coming in, over which years, what's coming into CCG baselines and what's coming into transformation funding, and all of it's real new money.
There's a lot that's fantastic going on, and it's great to get the encouragement with you coming to talk to us today, Claire. Great to see some of the new emphasis on children's services, widening the definition of young people, on women's perinatal services, but also a reflection that core services are also key to so many people that use our services too.
Presentation, we hope you will learn from our stories, take away something you can use in your work to do differently, to evolve something you already do, and we want to challenge the stereotypes for young carers and parents and people who struggle with mental illness.
My wish is that we could have holistic assessments. We could have treatment plans that encompass the whole of someone's needs. That we have an end to specialists working in silos and not talking to each other. Because I understand that comorbidity is far more common than any of us could ever expect.
Peer support would have been absolutely invaluable to me when I was ill, A, because I didn't recognise I was ill, and B, because everybody that came to my house told me I would get better, and I didn't care. I didn't want to hear from a, with all due respect, I didn't want to hear from a professional that I'd get better. I kept saying to poor Kim, show me a me-shaped person that has got through postnatal depression, and then I will believe you that I'm ill.
What I noticed later was that the younger lads started to look up to me and even asked me for advice on hospital and illness. One young lad even said I was the wisest person he'd ever met.
I think personally it comes down to just having the opportunity for there to be people with lived experience expressing their views and being listened to.
What you've heard today is so valuable to us if we're trying to get things right in terms of the way we develop our organisation and build our services. So once again, could you just say thank you to June and to the panel?